Hello everyone, so in this video I'll be giving you an easiest way to remember the coagulation pathway. So whenever you are drawing or writing the coagulation pathway, you should start with the common pathway. So always start with the factor 10. This one you have to remember that the common pathway starts with factor 10. So first the factor 10 would convert into 10a. Now we would keep dividing the numbers by 2. Okay, so when you divide the number by 2, when you have the number 10, we get number 5, but factor 5 is a cofactor, so we would write factor 5a. When you divide the factor 5 by 2, you get 2.5, but let's round it off to factor 2. So next factor would be factor 2, and when you have the factor 2, then we get the factor 1. Okay, so this was about the common pathway. Now let's see intrinsic pathway. So the intrinsic pathway starts with factor 12. After 12 we have to keep decreasing every number by 1. Okay, so we have to go in the descending order. So after 12 comes 11, so factor 11. Now about factor 10, factor 10 is already there in the common pathway, so we would skip the number 10. Okay, so next comes factor 9. But after factor 9 comes factor 8, but factor 8 is a cofactor, so we will write factor 8 here. Okay, so after factor 8 comes factor 7, but factor 7 comes in the extrinsic pathway, so we would make the extrinsic pathway here. And simple way to remember is that extrinsic pathway has only one factor, that is factor 7. So this is how you can remember. So first we will start with the common pathway, factor 10. After 10 comes 5, then 2 and 1. Then we would write the the intrinsic pathway, which starts with factor 12, then 12, 11, 9, 8, and the number 7 comes with the extrinsic pathway. Now there is one more mnemonic which is important to remember, is that I pity on my x, and therefore I would give tissue. Okay, so tissue for my x. So x stands for extrinsic pathway. Pity is pity, but not the original spelling of pity. So PT, the test PT is for extrinsic pathway. So therefore automatically the test PTT would be for intrinsic pathway. Okay, and one more thing in this is that tissue factor is a part of extrinsic pathway. It's a cofactor. So tissue factor is a part of extrinsic pathway. So that was about the coagulation cascade, and I've mentioned some extra things here. Is that the name of the factors I've mentioned here. Factor 2 is basically thrombin. Factor 1 is fibrin. And there is one more step where there is involvement of factor 13 and calcium, which is involved in the last step of forming a clot. There is also, you have to remember that thrombin would once there is activation of thrombin, it would cause activation of the coagulation cascade, and it activates various other factors as shown in the red. That the thrombin would activate factor 5, factor 8 and factor 11. So that was the basics about coagulation pathway.